Higher Medical College. My name is Джумагулова Индира Мухановна, and we are going to talk about diphtheria today. The aims of the lesson are development of skills of monologue and dialogical speech, expansion and systematization of vocabulary, development of the ability to understand foreign language and respond to it. What is diphtheria? What causes diphtheria? What are the symptoms of diphtheria? How to diagnose it? How is diphtheria treated? What is the complication of diphtheria? How to prevent diphtheria? Let's discuss it. First of all, let's learn new words. Contagious, to affect, whitish, patch, to spread, windpipe, complication, emergency, toxins, to proceed. Diphtheria is a serious contagious bacterial infection that affects the mucous membranes of the throat and nose. A type of bacteria called Corynebacterium causes diphtheria. The condition is typically spread through person-to-person contact or through contact with objects such as a cup or used tissue. You may also get diphtheria if you're around an infected person when they sneeze, cough, and blow their nose. Most visible and common symptom of diphtheria is a thick whitish patch on the throat and tonsils. Other common symptoms include a fever, chills, swollen glands in the neck, a loud barking cough, a sore throat, bluish skin. Your doctor will likely perform a physical exam to check for swollen lymph nodes. They'll also ask you about your medical history and the symptoms you've been having. To confirm the diagnosis, they'll take a sample of the affected tissue and send it to a laboratory for testing. Diphtheria is a serious condition, so your doctor will want to treat you quickly and aggressively. The first step of treatment is an antitoxin injection. This is used to counteract the toxin produced by the bacteria. Your doctor will also prescribe antibiotics. It is the second step, such as erythromycin and penicillin, to help clear up the infection. If not treated, can cause life-threatening complications, such as myocarditis, paralysis, kidney failure, and even death. Diphtheria is preventable with the use of antibiotics and vaccines. It's given in the presentation. Nowadays, diphtheria is extremely rare thanks to widespread vaccination against the infectious disease. And now, your home task is to read the text and do all the exercises. Thank you for your attention. See you.